It's called The People's Hospital, Hope and Peril in American Medicine, written by Dr. Ricardo Nuila. And based upon his experience as an internist at Ben Taub Hospital, it's a unique look at Ben Taub as a safety net hospital where they're to save lives of people who really come to them with no ability to pay, told through the stories of the people. Joining me this morning, Dr. Richard Nuila, Dr. Ricardo Nuila. I apologize for that. I keep calling him Richard. That's his dad. Not that I know your dad.
My dad would love this.
Thank you, Dad. Well, what inspired you to write this book?
It's really the patients that I was seeing at the hospital all the time. For years I was at Ben Taub learning medicine, and I'd hear about the odysseys that people had to go through in order to get health care. You know, they had insurance, but they didn't have enough. They got kicked out of private hospitals. The common thread was that they'd end up at Ben Taub Hospital. So that was one part of it, was just to detail for people what it's like out there, what it's like to have an illness and not be able to receive care. But the other part was just the care that people received at Ben Taub. The patients would tell me when some of them would get insurance and they'd stay in the system. Some of the doctors who worked there work at other hospitals, so it became this thought, well, we're giving actually quite good care, and that is contrary to the way that Americans think about health care. So it just became a book that I wanted to write, how public health care can be a way past our problems in American health care.
And there is a stigma associated with that sometimes, and especially say
Definitely.
people who are, uninsured, and that becomes a negative connotation.
Right.
But Ben Taub seems to go beyond that, at least from what I've read about the time that you are allotted for each patient, for example, as compared to what the real world is. It's actually pretty good medical care.
Quality care, and the focus is on patients, okay? In our American healthcare system, it's mechanized to think about transactions, okay? When you go to the hospital, everything is mechanized so that, the hospitals and the insurance companies know how much they're taking out. But when you have that's one of the things that I found out in researching the book and in working there too, is that I found myself liberated as a doctor to work and be able to listen to patients and focus on the patient. And that's one of the reasons why I wouldn't want to leave.
How long a process was it from the time you said, I think I need to write a book about, until the time you actually have done this?
Well, when I first got to Ben Taub, I heard whisperings from people say, somebody should write a book about this place. And that was like 20 years ago. But I really have been a committed writer throughout this. You could say that the process started officially in 2014 when I started to write an article about this. So 6-7 years. It's really hard to put a gauge on it, but it's taken a long time, yeah.
One of the stories, tell me about one of the stories that sticks out for you. You tell stories in the book about the People's Hospital. What sticks out, one of them that you could share?
Well, Stephen, he is a restaurant manager, earns $75,000 a year, and he elects, like so many people, he elects for his lowest cost health insurance that's provided, just because he's never had to use health care before. But when COVID starts, he found that he's got a lump on his neck and he's got fevers. He has to go to a private hospital, and already at the private hospital, $600 just to sit in the waiting room of the emergency room. He gets finally ping-ponged around and gets the care, and a doctor comes out, says the CAT scan shows that you have cancer, neck cancer. However, he says, and that's the operative word that we've gotten used to in American healthcare. However, you don't have enough insurance. He feels crestfallen. He's like, how does this happen to somebody in the United States, that somebody says, however, we can't treat you? Somebody comes in to his room and says, go to Ben Taub, go to the public hospital. And Stephen, like so many Houstonians, feels like, oh gosh, public hospital, this is gonna be where other people go. But his journey through the public hospital is in the book. And I'll let the readers decide what they think about it.
Very enlightening for those, if you get a chance, it's an opportunity to really find out about what's really going on. What would you want most readers to take away from reading your book?
We can do something about healthcare in America. I think all of us know that wherever we go to the hospital or to doctors, that it's a broken system right now. It's not a system, it's an industry. But Houston has a model where we can actually, if we invest in public health care, we can bring down costs for everybody and improve the quality of care by focusing on people, not profits.
So you've got to be excited about the bond then, right? You're pretty excited.
I'm very excited about the bond because I think it's needed. And I think that this is a wonderful institution. I stay at this institution because it has a mission. It's in line with medicine, and I love to be a part of that mission.
The title of the book is The People's Hospital, Hope and Peril in American Medicine. Dr. Ricardo Nuila.
Thank you, Ken.
Apologies, Richard. Congratulations on the book. Thank you for what you're doing in this community. We appreciate it so much.
Thank you very much, Ken, bro. Appreciate it.